and follow the principles of LRR technique as low as reasonably achievable. So maybe one radiograph is enough to give you the information, so you don't need to send this patient for another radiograph. And some patient, they have radiotherapy, history of radiotherapy, especially the elderly patient. So you need to be very careful with these patients. And a careful follow-up of this patient is recommended since they are special risk due to the biological effect of ionizing radiation. Sometimes they may develop the xerostomia, radiation carries, or recurrent tumor, or radiation-induced tumor, radiation-induced osteonecrosis of the jaw. So depending upon the history of the patient, if there is any history of radiotherapy, you must be very careful with this patient, not only for the radiograph, also the treatment planning of this patient. Sometimes they take administrative images, and especially for the dental students, they take radiograph. If there is no many kidneys available in your college, sometimes they expose each other, but which is not recommended. Sometimes in the for allowance, dental allowance, sometimes you need to submit the radiograph in your office. Sometimes some patient will ask to take another radiograph to submit in their office, but which is not recommended. So always remember, don't expose your patient or yourself unnecessarily to anything. So always remember, as low as you can expose the patient, which is beneficial for the patient and also to you. It is inappropriate always to expose the patient to without their informed consent when their examination is not beneficial for their healthcare. I think that's all for today. Thank you. So I'm open for any questions now. Okay. Thank you.
Thank you, Dr. Zaman, for your brief explanation. I think it's a really nice topic, and I'm pretty sure it will be very applicable for our students and residents, as it is so important for dentists to know how to choose the most appropriate imaging for each case in daily practice. So now let's move on to the Q&A session. We have about 10 minutes for the session, so I think we'll take about 3 questions. Please, to all participants, if you have any question to ask, I open for discussion session. You may raise hand or write your questions into the chat box below. I think there is one question, Dr. Zaman, in the chat box. The Dinda from Dinda Nurul.
Yes, I'm just reading this question.
Yeah, regarding the TMD.
So regarding TMD, suppose if you think there is any the clicking sound, okay. Firstly, you will go for panoramic radiograph. Okay, in the panoramic radiograph, if you think is within the glenoid fossa, the condylar head, you may also go for 2D view, the CBCT. If you are suspecting that there is any dislocation of the head of the condyle, you may go for CBCT. Or you are suspecting this there is the condylar head is in position, but maybe suspected disc dislocation. Then you will go for MRI view. In MRI also, you will see the TM joint head, but it will not be clear as in the CBCT. So depending upon your preliminary examination, maybe panoramic radiograph, then you will go for either CT or CBCT.
Okay, the second question is, are there any specific restrictions for an individual or a child to get exposed for periapical radiographs? Like how many times a day that they can get a radiograph examination?
Actually, the amount of ionizing radiation in dental radiographs, it is very less comparing to medical CT, medical chest X-ray or any other X-ray, it is very less. So if we keep this information among us, not exposing to the patient, it is not harmful for the patient. So you may expose multiple times for the children, but for the children, it is not recommended, especially the 3D views or CT or CBCT. At least the patient need to be for especially the panoramic radiograph. It is better not to expose them under 5. And for CT, CBCT, unless, again, I come to the same point, risk versus benefit. Okay. If it is necessary, you need to expose, you will expose this patient. But, children patients are very difficult to handle. And if there is any movement of this patient, in case of CT or CBCT, you need to take, there will be movement from the patient and your image will be blurred. So necessary information you will not get. For periapical radiograph, I think it's how many you can take. If it is taken the whole jaw, you can take for the patient. It is not would be harmful for the patient. Okay. Thank you. Okay.
Is there any more questions? No. Okay. Continuing about the TMD, previous TMD questions, Dr. Zaman. I've seen many dentists refer for this refer for panoramic radiograph for the TMD patients, as MRI and CBCT is expensive and not accessible in all areas. So, is it appropriate enough to assess the TMD using only panoramic radiograph? What kind of information that we might miss if we only have panoramic?
In the panoramic radiograph, yeah, okay. You will only see the bony changes. You will not see the disc or soft tissue if there is any disc dislocation. Or in the CBCT, we have an option to take this TM joint radiograph in the closed mouth and open mouth view, so that we can compare in the closed mouth position and open mouth position the condylar head. So in case of panoramic radiograph, you will see only one closed mouth view. So you cannot see whether any deviation, any dislocation, you cannot assess in the 2D views.
So there is limitation in panoramic radiograph.
Obviously, there is a panoramic radiograph is 2D view, and in the CBCT or MRI, you will get a 3-dimensional view, so that you will see whether mesial or medial lateral dislocation or whatever you have, you will get full information in the CBCT or MRIs.
Thank you, Dr. Zaman. We have 5 minutes left. Is there anyone to ask their questions? If you have any questions to ask, you may raise your hand. No? Okay, one last question.